Assalamualaikum warahmatullahi wabarakatuh. Today, myself is Sana Bemuld Al-Nafisi and Ashila Fitria will talk about overconfident know-it-all patients. Start from introductions. Overconfident is a common cognitive bias in healthcare that can affect both professionals and patients. In patients, overconfidence may lead to inappropriate health decisions, reduced consultations with healthcare professionals, and increased risk of harm. And then, the definition is overconfident refers to an individual's tendency to overestimate their knowledge, skill, or ability. It is closely related to the Dunning-Kruger effect, where individuals with low knowledge tend to overestimate their competence. People may believe they understand a condition or treatment better than they actually do. Alright, Dunning-Kruger effect is example why know-it-all behavior occur. Individuals with lower competence often overestimate their knowledge, fail to recognize their own limitations. This creates a gap between perceived and actual ability. While impatient, they may feel confident about diagnosing themselves. They underestimate the need for professional advice. Overconfident as a bias in healthcare is considered one of the most dangerous cognitive biases in healthcare. It contributes to poor decision making. It can lead to diagnostic error and inappropriate treatment. It reduces willingness to seek or accept additional information. Overconfidence is described as the mother of all biases in medical decision making. And then the next, overconfident patients often demonstrate behaviors such as self-diagnosing with the proper knowledge, ignoring advice from healthcare professionals, relying on previous experience or internet sources, self-medicating without consultations. And a study found that 74.2% of participants practiced self-medications. Many patients use antibiotics without prescriptions. This reflects patients believing they already know enough. And next is Chia.
Now we talk about overconfident patient behavior. Overconfident patients tend to rely on their own understanding rather than professional guidance. They may diagnose themselves with medication without consultation or depend on previous experiences and online information. A study showed that 74.2% of individuals practice self-medication, indicating a high level of confidence in managing their own treatment. This type of behavior can negatively affect patient safety. Overconfidence may lead to delayed diagnosis, incorrect medication use, and poor adherence to prescribed therapy. As a result, patients may face complications that could have been prevented with proper consultation. Overconfident patients can create challenges during healthcare interaction. They may question or reject professionals' advice and rely more on their own beliefs. Additionally, patients often expect healthcare providers to appear highly knowledgeable, which can influence how they perceive and accept information. Pharmacists play an important role in managing overconfident patients. They need to provide clear and evidence-based information, correct misconceptions in a respectful manner, and encourage patients to seek appropriate medical consultation when necessary. So the conclusion, overconfident patients tend to overestimate their knowledge and underestimate potential risks, leading to unsafe health behaviors such as self-medication. Understanding this behavior is important to improve communication and ensure patient safety in healthcare setting. So maybe that's all from us. Wassalamualaikum warahmatullahi wabarakatuh.